Hi, my name is Victoria Galinsky, and today I'll be talking about the sociocultural interpretation of schizophrenia. While research has yet to clarify what the precise causal relationship might be, sociocultural theorists believe that schizophrenia is a result of multicultural factors, social labeling, and family dysfunctioning. So, first, I'm going to talk about what schizophrenia is. Schizophrenia is a psychotic disorder where there is a presence of perceptions, thoughts, emotions, and motor functioning that is unusual or disturbed, which often results in personal, social, and occupational deterioration. A person with schizophrenia is perceiving the environment differently, so the world around them may look and sound different to them than what it does to everybody else because they have a looser grip on reality. This concept is psychosis, which is the loss of contact from reality. This manifests as false sensory perceptions and false beliefs, also known as hallucinations and delusions, respectively. There are three types of symptoms which are categorized as positive, negative, and psychomotor. Positive symptoms add on to a person's behavior, such as delusions, hallucinations, heightened perception, and disordered thoughts or speech. Negative symptoms are what is lacking in a person. So, this could be their ability to speak continuously and coherently, which can be marked by long pauses or slow speaking. A lack of expression and emotion are also considered to be negative symptoms. So, in a situation where they should respond with a certain emotion, like being happy for someone or being sad because somebody died, they may not respond to with emotion. And there's also a loss of motivation. So those with schizophrenia also tend to withdraw socially, and you may see that they start to spend more time at home, are less likely to go out or communicate with their family or friends like they did before. So there's also psychomotor symptoms that are the physical symptoms that a person with schizophrenia displays. These may be odd gestures or bizarre movements, and they may even freeze in one of these strange poses for extended periods of time, which is known as catatonia. So while studying all kinds of psychological abnormalities and disorders, there's always some sort of a connection between the mental illness and the social world and how it can cause or affect these mental illnesses. While the biological and psychological views are much more researched and backed by clinicians, sociocultural theorists may have important input on schizophrenia and the relationship that schizophrenia has with the social world. So there is the multicultural aspect, and among those with schizophrenia in America, there is a noticeable, or throughout the world rather, there are noticeable differences based on their cultures, their races, and ethnicities. So here in America, there's a particular difference between African Americans and white Americans. For example, 2.1% of African Americans have been diagnosed with schizophrenia, which is more than white Americans at 1.4%. Similarly, African Americans compared to white Americans are more likely to be diagnosed with symptoms of schizophrenia such as hallucinations, paranoia, and suspiciousness. We also see an overrepresentation of African Americans with schizophrenia in hospitals, such as in Tennessee, where they make up 48% of the schizophrenic population in the state hospitals, while the state itself only has a 16% African American population. So the reason for this is unknown, but the possibilities include that there could be African Americans may be more prone to this disorder, that clinicians from majority groups such as white Americans are biased in their diagnoses, or that cultural differences are being misinterpreted as symptoms. There's also the question of economic standing, where we see that when we put African Americans and white Americans on the same economic plane, the rate of schizophrenia between the two groups become more similar. There are also differences regarding schizophrenia across countries. Interestingly, those that are in currently developing countries have a higher recovery rate than people suffering from schizophrenia in the West and in other developed countries. So this could be due to genetic differences among different populations, but sociocultural theorists suggest that the emphasis on family and community togetherness in these developing countries may create a more supportive environment for a person with schizophrenia to heal. Then there is social labeling, which sociocultural theorists believe may have a negative effect on those suffering. A person may even be mislabeled as schizophrenic for not conforming to society's idea of normal behavior. Those that are labeled, whether genuinely schizophrenic or not, may take the label on as a self-fulfilling prophecy and take on more of the attributed symptoms, which can further develop schizophrenia or kind of not cause it necessarily, but kind of inspire symptoms to become worse. So society may call those few people that are schizophrenic crazy or look down on them. So a person that does have schizophrenia may take on this role in order to fulfill this expectation that other people have of them as a mentally ill person. There was a study done known as the Rosenhan study where several people presented themselves as patients showing schizophrenic symptoms at several different hospitals. So here's where the stigma started to become apparent. Even after the symptoms had subsided, it was very difficult for the patients to leave these hospitals. They reported that the nurses showed very little interest in them and often acted as if they weren't there. There was even one incident where one of the nurses adjusted her bra openly in front of a room full of male patients as if they didn't have the ability to realize what's going on around them or were even there in the first place. The patients said that they felt bored and powerless, which isn't really a healthy way to feel when you're trying to heal, so it's not a proper healing environment. And so we can see through the study that these labels can further establish such a stigma and also affect how a person with schizophrenia views themselves. So we really have to consider how diagnosing and labeling affects those that have schizophrenia and other mental illnesses. And then there is family dysfunctioning. Theorists suggest that certain patterns in families and homes can promote schizophrenia and cause it to further progress. There is the double bind theory, which is one of the more prominent explanations of how family life can affect schizophrenia. The double bind theory is when a parent communicates pairs of contradicting messages, which can confuse a child. So these contradicting messages usually consist of a verbal communication paired with a contradicting nonverbal communication. So an example of this could be a parent who asks their child how their day at school was or what they did that day, and then continue to show no interest or do something else while the child is speaking. So the child may end up feeling like nothing they do is right and nothing they can do can satisfy their parents or make them happy. So they may develop schizophrenic symptoms to deal with this double bind. There's also the role of family stress in schizophrenia, which has been backed by research. Parents of people with schizophrenia often present conflict, have difficulty properly communicating, and are more critical and overly involved in their children's lives than the typical parent is. So those with schizophrenia in high emotional expression families are 4 times more likely to relapse than those that are in low emotional expression households. So a high emotional expression household is one that is characterized by frequent criticism, disapproval, hostility, and invasion of privacy. So there's also the question that we have to keep in mind is that perhaps the high stress it could be caused or is contributed to by the member with schizophrenia. So we have to keep an open mind that all that stress may not just be one-sided and it could be from the person with the mental illness as well. So, like in every situation where we are discussing the causes of mental illnesses, it's important to look at all the different aspects and combine different views so that we can have a deeper understanding of the illness from every different angle. So, as social beings, I think that the sociocultural view is usually really interesting in that it shows us while we need socialization and society in our lives, they may also contribute to the illnesses like schizophrenia in people. It's important to understand things from different cultural views and also recognize possible biases in diagnosing, such as the possibility of a clinician looking down on African Americans as less mentally stable or viewing cultural differences as mental abnormalities. Earlier this semester, we noted that labels can be a double-edged blade in that it helps us treat illnesses once we are aware of them, but it can also cause a stigma and self-fulfilling prophecies in patients where once they are given the medical label, they will seek out these other symptoms and start presenting them. So, looking into family interactions also helps us understand how schizophrenia and its symptoms can result from socialization and how strongly our families can affect our mentality. But we also have to keep in mind that the stress within these families and stuff may be a result or contributed to by the person with schizophrenia, because having a person in a family with mental illness isn't necessarily easy. So, there could be stress added from that. But overall, I think that the sociocultural view of the causes of schizophrenia provides us with really valuable information and a different viewpoint for us to study schizophrenia, so that way we can get a deeper understanding of something as multidimensional as a mental illness, especially something like schizophrenia, and we can then, further learn more and help those who are suffering.